Hey students, this is Dr. Gonzalez. I hope you're doing well when you're watching this video. And yes, I did cut my hair recently, if you were wondering. And you know what, let's just go ahead and get started with the following topics for today. So we're gonna start first with the vagus nerve, cranial nerve number 10. And so this nerve contains motor and sensory fibers. Specifically, it originates from the medulla oblongata, which is this structure right here. And it exits the skull through the jugular foramen, which is this foramen right here. It's gonna descend in the neck within the carotid sheath, first between the internal jugular vein and the internal carotid artery. This right here, it's the internal carotid artery, and later more inferiorly between the internal jugular vein and the common carotid artery, which is this structure right here. The vagus nerve has two sensory ganglions which contain cell bodies of sensory neurons of the vagus nerve. So these are the ganglions. There's a superior ganglion, which is small, and it lies on the vagus nerve within the jugular foramen, so around this area right here. And there is an inferior ganglion, which is larger, which is this one right here, and it lies on the vagus nerve just inferior to the jugular foramen. Now let's go over the vagus nerve branches within the jugular foramen. So first of all, we're going to have a meningeal branch. So this meningeal branch supplies the dura mater of the posterior cranial fossa. There's also, as you can see here, an auricular branch which contributes to supply the auricle, also the external acoustic meatus, and the tympanic membrane. Another branch is the right and left recurrent laryngeal. So for example, this one we're seeing here is going to be the left recurrent laryngeal nerve, and this one curves around the inferior aspect of the aortic arch. Meanwhile, the right recurrent laryngeal branch, which is the one we're seeing right here in blue, curves around the inferior aspect of the right subclavian artery, close to its origin. The vagus nerve also has some branches in the neck, which includes the pharyngeal branch. This one supplies the motor innervation to most muscles in the pharynx and the soft palate, as you can see right here. And there's also a superior laryngeal nerve, which is this one right here, which divides into an internal and external laryngeal nerve. So the internal laryngeal nerve, it's going to be more sensory. This pierces the thyrohyoid membrane with the superior laryngeal vessels, and it supplies the sensory innervation to the mucosa of the laryngopharynx and larynx as far down as the vocal folds, and also a small area on the posterior part of the tongue. There's also an external laryngeal nerve. This one, it's motor, and it supplies the cricothyroid muscle and part of the inferior pharyngeal constrictor muscle. The next cranial nerve we're going to discuss is cranial nerve number 11, or the accessory nerve. This one is formed by the union of two roots. Here's your accessory nerve. And the two roots, it's the cranial and spinal root. Now, the cranial root originates from the medulla oblongata, which is this part right here. And the spinal root originates from C1 to C5 segments, which is this part right here in the spinal cord. And so the accessory nerve ascends in the vertebral canal and enters the posterior cranial fossa through the foramen magnum. The cranial and spinal roots of these nerve, they will join and exit the posterior cranial fossa through the jugular foramen. Inferior to the jugular foramen, the two roots separate, and the cranial root joins the vagus nerve. The spinal root then supplies the sternocleidomastoid and the trapezius muscle. And so lesions to this nerve are characterized by a shoulder drop on the side of the lesion, for example, or difficulty with full abduction and elevation or shrugging of the shoulders on one side of the lesion, or difficulty rotating the head to the opposite side of the lesion. Lastly, the other cranial nerve we're going to see in the area of the neck, it's the hypoglossal nerve, or cranial nerve number 12. The hypoglossal nerve contains motor fibers that supply all the muscles of the tongue except the palatoglossus. This nerve originates from the medulla oblongata, which is the structure right here, and it exits the skull via the hypoglossal canals, which are those canals you see in blue right there. The hypoglossal nerves will descend almost vertically to approximate the level of the angle of the mandible, where it curves around the occipital artery and turns forward towards the tongue. The hypoglossal nerves, as it enters the oral cavity, they will pass medial or deep to the mylohyoid muscle and lateral or superficial to the hyoglossus muscle. And this is, for example, the hyoglossus muscle. Opposite to the atlas, the hypoglossal nerve, it is joined by the fibers from the ventral ramus of the C1 spinal nerve. And these fibers are going to supply the motor innervation to the infrahyoid muscles and the geniohyoid, and sensory innervation to the dura mater of the posterior cranial fossa. So, the only branches of the nerve that contain true hypoglossal fibers are those innervating the tongue muscles. So, a lesion to the hypoglossal nerve could cause paralysis of the tongue muscles on the side of the lesion. When the patient is asked to protrude the tongue, this one will deviate towards the affected side. If the lesion is on the right side, then there's going to be muscle atrophy on the right side of the tongue, giving the mucosa a wrinkle appearance. And when the patient is asked to stick his or her tongue out, its tip will deviate to the right side. Okay, now let's go over other structures that are part of your nervous system. Particularly, we're going to talk about the cervical part of the sympathetic trunk. So this is an upward continuation of the thoracic sympathetic trunk, which you can see right here and right here. This lies posterior to the carotid sheath and anterior to the prevertebral muscles. It receives no white communicating rami, so these preganglionic fibers for the cervical sympathetic ganglia will originate from the upper fourth thoracic segments of the spinal cord, and then they leave the spinal cord in T1 to T4 spinal nerves. After that, they enter the upper thoracic sympathetic trunk via the white communicating rami, and they will ascend through the sympathetic trunk to reach the cervical ganglia. Now, usually this cervical part of the sympathetic trunk consists of three interconnecting ganglia. There's going to be a superior cervical sympathetic ganglion. There's going to be a middle cervical sympathetic ganglion, and also an inferior cervical ganglion. Sometimes there's a fourth vertebral ganglion that is present on the anterior aspect of the vertebral artery close to its origin. And so all of these branches that originate from this ganglia contain postganglionic sympathetic fibers. Let's get started with the superior cervical ganglion. So this is the structure you see right here in blue. And this is the largest ganglion of the sympathetic trunk. It lies at the level of C2 and C3. And the branches are going to be to the internal and external carotid arteries to form plexuses around these vessels and their branches. So here is, for example, that internal carotid artery. There's also going to be some great communicating rami to the spinal nerves of C1 to C4 to the pharynx and the heart. The other ganglion is the middle cervical ganglion. This is the smallest and most variable of the cervical ganglion. This commonly lies at the level of the C6 vertebra, which is this one right here, close to the inferior thyroid artery. This middle cervical sympathetic ganglion has these branches that have great communicating rami to the spinal nerves C5 and C6, to the thyroid and to the heart. Now there's also an inferior cervical ganglion. This commonly fuses with the first thoracic ganglion to form what we call the cervicothoracic or stellate ganglion, which lies anterior to the transverse process of C7 vertebra, which is this one right here, and the neck of the first rib, and posterior to the origin of the vertebral artery. The branches include the gray communicating rami to spinal nerves C7 and C8, to the vertebral and subclavian arteries to form the plexuses around these vessels and their branches, and it also supplies the heart. And if you want to learn more about this information, click on the video here at the top that is suggested for you. And that is it for today. Don't forget to like and subscribe if you're liking what you're watching, and I'll see you on the next one. Thank you for watching. Bye.